You
All right,
ready?
yep, go ahead.
Okay. Good afternoon. Welcome. My name is Brent Elrod. I'm Acting Division Director within the Institute of Youth, Family, and Community at USDA's National Institute of Food and Agriculture. I'm joined by my colleagues Sydney Turner and Chris Petty, who are going to be helping us today with the applicant webinar for the fiscal year 20 funding for the Rural Health and Safety Education Competitive Grants Program. Today's webinar is being recorded. We're going to ask you, as you have questions, to insert that information into the chat box. We've got designated Q&A periods that will stop periodically between the slides to take and respond to those questions as best we can. We appreciate your interest in this grant program, and especially now as we find ourselves in the midst of a pandemic, it's even more critical and important as ever that we get the necessary educational programs to rural communities across this great country of ours. Two links for you, and you'll see them there where you can download the RFA either directly from the NIFA website or from the grants.gov page. You can always just do a search on either of those through your favorite browser to be able to quickly pull them up. What we're going to cover today are these 5 particular topic areas: program basics, administrative requirements, the application process itself, what then happens once you submit an application, what occurs in terms of the evaluation and review, and some general tips for success. What we've been able to note over the years helps to improve the quality of applications. So this slide, a lot of information. It is directly excerpted from the RFA. So again, make sure you download it, read it closely. We are seeking applications that are going to provide individuals and families living in rural areas across these bullets: information as to the value of good health at any age, information to increase individual or family's motivation to take more responsibility for their own health, including in the context of COVID-19, information about and access to health promotion, information and support for utilization of telehealth, especially related to distance learning strategies related to opioid education, and training in minority rural communities. Also, training for volunteers and health service providers concerning health promotion and healthcare services for individuals and families. So again, these are very broad areas purposefully, and we'll ask you then to drill down based upon some of the additional information here listed. Proposals should focus on the prevention and/or reduction of opioid misuse and abuse per guidance offered by Congress. Proposals can also focus on helping prevent the spread of SARS-CoV-2, or known as COVID-19, and also coronavirus, and in mitigating infection and transmission. The acronym is RHSE for Rural Health Safety Education when you see it. So these are the particular projects that we're looking for: implementing new extension programs or approaches in the area of individual and family health education focused on the prevention and/or reduction of opioid substance misuse and abuse, or the prevention and/or mitigation of infection and transmission of coronavirus. In addition, implementing new extension programs or approaches that support the utilization of telehealth, especially related to opioids or SARS-CoV-2 in minority rural communities, and also any projects that may be seeking to scale up state or multi-state levels that are already established programs. We get lots of questions about eligibility. The eligibility is limited to land grant institutions. Those are our 1862 institutions, our historically Black colleges and universities, and our tribal institutions, referenced there by the year that the legislation enacted and brought them into our system. Award recipients may subcontract to institutions and organizations not eligible to apply as lead applicants, provided those organizations are necessary for the conduct of the project. So in other words, if you are a private or public non-governmental organization, private entity or NGO, you could subcontract on these projects, but you have to have as a lead a land grant institution. We anticipate making multiple awards, and $4 million is available. $3 million of which is for the traditional programs, but this year Congress has added $1 million specifically for telehealth, telemedicine, and distance learning strategies for education and training in minority rural communities. So again, we're looking for specific programs in this topic area. It's important to notate that through your narrative so it's clear then that you're seeking funding in this particular area. The maximum award is $350,000 for a 2-year project period, and that project period is listed here and in the RFA, September 1st of 20, and it should say 20 there, and go to 22. So I've got a typo there. So we'll note that, and I'll just go ahead and make a statement here. We've got this RFA posted for 2 years for both the fiscal year 20 and the 21 cycle. And so we'll come back again in 21, but this RFA is for both years, but we'll be back for a subsequent cycle that will have those particular award dates, 21 to August 23. Project types. While these are not limited to implementing extension-created programs or approaches, projects must do at least one of the following. Or actually a combination of these. Use research-informed outcome-based programs and approaches. Use cooperative extension as the primary model of program outreach and delivery. Implement programs and approaches in federally classified rural counties, and coordinate with state offices of rural health in the particular states or regions that they may be working. In addition, if projects are addressing coronavirus, they must demonstrate how they will coordinate efforts with CDC or their affiliates. In other words, we want to ensure that we're using evidence-based and promising practices as promoted by CDC in terms of our efforts. And so demonstrating that collaboration is important. In addition, RHAC projects are highly encouraged to develop meaningful collaborations among 1862, 1890, and 1994 land grant institutions within a given state or region, have a health education focus, and be working with an existing health framework. And the preferred is the Cooperative Extension's National Framework for Health and Wellness. Develop and report on performance indicators that capture measurable change in knowledge and attitudes, and collaborate across extension program areas. So in this particular instance, family consumer sciences, agricultural and natural resources, 4-H and youth development, and community resource and economic development. This is true for all grants. Any good practice, you need to know your audience, who and where they are and what they need, and how, in that case, you're going to engage, educate, and assist them. Your plan of work should be ambitious yet achievable. Make a compelling case about the need. Use recent data, and avoid any duplication of existing or current efforts underway, unless you are really looking to scale up an existing project. It's important to do your homework, build on the prior experience, and also to avoid any duplication. Here's a dedicated link that is pretty wordy there. You might want to take a screenshot with your phone. These slides and this transcript will be posted on YouTube. Usually takes us about a week to get everything cleaned up and posted. So that could be time you're working on the grant. So hopefully you're taking that link and determining then what's previously been funded. This is what the page will look like when you go to it. You'll see then that you'll be able to find a list of programs to be able to read the brief and the full abstract for projects that have been funded under this title. So you see just a few examples of those. And in the past, past couple cycles, we've been focused on opioid prevention. So you see a number of that referenced here. Two kinds of applications can be submitted. Those that are brand new, never been submitted to us before. Those that are resubmissions of previously unfunded projects. In that particular instance, you can come back and respond to reviewer comments and potentially enhance your chance for being awarded. It's important to understand what will not be considered for funding. If you put a lot of effort in and they get disqualified at the outset, it's a lot of wasted effort. So proposals without a plan for evaluating outcomes, proposals that might fit other areas better or other existing NIFA grant programs, and you see them listed there. Proposals with a focus on basic research parenthetically, other than evaluation related to project outputs, outcomes, and impacts. No formal education and no clinical interventions. This is extension outreach. Proposals focused on the clinical treatment of individuals with substance abuse disorders will also not be included for review. And then any of those that come in over the project amount or for less than the full project period of performance. For this grant program, applications do not require matching funds. And even if you have matching funds or in-kind support, that will not be considered as part of the evaluation process. You must submit applications through grants.gov. You must follow all guidelines in both the request for applications and the NIFA grants.gov application guideline. As you see there, and likely already aware, the proposal submission deadline is July 1st, 5 o'clock Eastern Standard Time. So we'll stop and pause here for some initial questions and answer. And so if you have been typing those into the chat, I'm going to ask Sydney to take them in order, and then I'll make my best effort to respond. And certainly as you're going ahead, hearing those, go ahead and type yours in so they can be answered in this period as well. So Sydney, any questions?
Yes, before we get started with questions, I will note again for those that missed it, this will be available and shared via YouTube through our website in about a week. So for those asking, will this be shared? It will. First question comes in. Is it opioid education and training as a focus or education and training as a separate activity?
I guess I'm struggling to understand the nuance of that. So uh, uh, we are looking for extension programs that are going to provide education and or training depending on the scope of work that's proposed. So we're targeting, depending if you're targeting individuals, families within the community, or healthcare workers, it may differentiate your particular focus in terms of whether you're providing that education and how, and or if you're training healthcare workers so that they have the benefit of the information to work then directly with individuals and families and communities. So if I have misunderstood or haven't responded, if you can restate it in the chat, then we'll give it another try. Next.
Next question. Just for clarification, do all projects need to focus on either opioids or COVID-19, or will other projects be considered that are outside of opioid or COVID-19 focus?
Yeah, other projects will be considered. Again, just to remind that Congress has indicated that they want programs that are continuing to ensure that opioid education is helping to prevent substance misuse. So those are certainly encouraged. Clearly, we're in the midst of a pandemic where we've identified challenges associated with racial minority disparities. That would be certainly appropriate, but you may go outside those two particular areas if you have other particular areas of interest.
Okay, next question. Does activity need to be in rural counties only, or does it need to be in at least some rural counties? Additionally, where can we find the most recent federal classification of which counties are rural?
Yeah, so there are dedicated links in the RFA, so I'll just direct folks back to the RFAs. Certainly, we're going to have, this is the Rural Health Safety Education Program, but it may well be that you are in a county that has a large metropolitan area and then surrounding counties that are going to potentially be rural based upon the classifications. In those instances, it's important for you to make sure that you make a compelling case to reviewers so that they understand why you're choosing a particular target area. But again, I'll direct folks back to the RFA, the links to the classifications to be able to make those determinations before submitting their proposals.
Okay. Their next one that I'm seeing here, much of our state is homogeneous. How are you addressing the lack of minorities or low population of minorities in rural areas?
Well, I'm not. So I guess I'll flip the question over. How do you intend to do that and to make that case, based upon your particular state population and makeup? And so, especially with the telehealth options, the congressional language is very specific in terms of targeting minorities. So the opioids, the other potentially general do not have those same requirements. So again, depending upon what you're proposing, you'll need to make those decisions and ensure that you make the case demonstrating what the population is and why you're choosing to serve them.
Okay. Again, next question. Will projects that are not primarily opioid or COVID-19 focused be considered?
The answer is yes.
Next question. Can you involve after school programs? Are you allowed to provide information and education to public schools as a piece of the work being done?
So let's go back and look at that specific language there. So these types of applications will not be considered, and that's that third bullet down. Proposals with focus on basic research, and those that include formal education. So informal care would appear to be outside of the formal education process and would thus be allowable.
Okay. Next question I'm seeing here. 50, my 501c3 organization trains veterans to find agricultural jobs. We do use telehealth and telemedicine. If we partner with a land grant university, can some of the services take place at other educational institutions or must they all take place at the land grant university?
No, so the land grant university has to be in the lead, and then depending on the proposal, then the subawardees can provide services again based upon the other requirements of the RFA.
All right, next question. How would you like us to coordinate with the CDC and prevention of COVID-19?
So in this particular instance, I think it's really important to be able to demonstrate that you're using the latest and most update information in order to demonstrate then that as you provide this potential education, outreach, training, that we're confident then, that, based on the fluidity and the rapid changes that we continue to hear related to the pandemic, that it demonstrates that you're on top of it. You're in collaboration. CDC is doing weekly calls for private entities, and so there's one way to demonstrate that you're participating in that. Getting signed up and receiving that information, and then we'll also encourage you to have those conversations with your state departments of public health that are also likely to be receiving the latest information.
Okay. Next question. Is the telehealth focus one, training those in rural communities and minority communities how to use telehealth slash boost capacity, or two, using telehealth to research rural and minority rural communities, or both?
It's the former. It's how then, if I'm a person living in a community and really either have a distrust of telehealth options or just don't understand it, likely those two may be related, then how am I being educated in order to take advantage of this opportunity? We're hearing lots of instances where folks are choosing not to go to the doctor or to seek out preventive medical care because of their concerns about COVID-19 spread and in the community. And so what are some of those opportunities that may present in order to help folks understand then that here's another alternative and a way to ensure that folks are taking good care of themselves?
Okay. Next question. Will grants that request funding to support 1 year of planning with the second year program implementation be supported?
they likely won't score well with reviewers. We're really looking to lift up projects and to move them forward. So again, just go back and look closely at the RFA and the evaluation to be able to tailor your proposal to meet those.
All right. Next question that I have here. What about targeting vulnerable populations and prevention?
Certainly,
Next question. Does the grant support funding for patient in-home medical equipment such as blood pressure cuffs, glucose monitors, electronic stethoscopes?
it does not.
If your university or extension currently has a NIFA award, can a proposal be submitted for fall 2020 from a different department?
Yes.
And I'm seeing no more questions at this time.
Okay, we'll move forward. We're going to talk next about administrative requirements. You see the bullets there, the direct and indirect costs, organizational management, reporting, and contact for further questions. This is standard for most federal grants and certainly for NIFA grant awards. These are unallowable direct costs that you see here. So you may not use it for construction. You may not use it for incentives. You can't have promotional giveaways. You can't have meals before or after. You could have lunch during a meeting with necessary justification for that. So it would need to be a working meeting, and clearly, no surprise there, alcoholic beverages, entertainment, costs after the expiration date are unallowable. Indirect is limited to 30% of the total federal funds, also limited the lesser amount based upon your rate or the equivalent of 30% of total federal funds awarded. And for our land grant universities, again, fairly common across most of our, well, a lot of our grant programs, and your office as a sponsored research will be helping you with these. Federal rate, it will be in place again in almost every instance there, so I'm not going to spend a lot of time on the de minimis. There is a dedicated link there to indirect cost processes, but again, working with your sponsored research offices, they should be able to help you through these. Successful applicants that are new to USDA must submit specific management information, again, unlikely to be the case for our land grant institutions. The reporting information, again, is pretty standard across our grant programs. It'll require project initiation if you are selected for an award. It's going to be real important, and I hope folks that put their applications together realize then that that's just the start of the work. If they get the award, then we're going to ask you in short turnaround to get a project initiation to us as we move later into this fiscal year. In addition, you see other reports that are required during the life of the grant. Jeanette Jensen is one of our administrative contacts. Her phone number and email address will be repeated on our final slide when we're doing Q&A. So I'm going to talk now about the application process. Again, your institutions are going to be likely updated with grants.gov, so this should be less of an issue. However, because we are in many instances continuing to work remotely, especially with our smaller institutions, may not have access to some of the latest softwares and or technology. So it's important to ensure that all those pieces are in place so that you don't run into any late breaking challenges that prevent you from submitting your application on time. Again, this goes back to the link at the NIFA page where you can download the RFA and get the synopsis of the grant program. Once you do, you're going to need to complete the application and all required attachments. Some are forms, but some also need PDF attachments. Submit all information, read and follow all instructions. And within that, then, here are the actual components of the proposal. A 250-word summary abstract and a 15-page narrative that includes all of those sections below. So your limit is at 1.5 point. So that, what is that again? It should be, help me with that one, Sydney. 11?
1.5 space pages and
All right.
no smaller than 11-point font.
All right, that's what I missed putting in there. All right, so You see also then down highlighted in red, if you are resubmitting an application, you get one additional page to be able to respond to previous reviewer comments. And do not take that lightly, because if you don't adequately respond to the previous reviewer comments, it's unlikely that you'll be able to move forward and cross the funding threshold. So spend additional time there, and also to emphasize whatever those enhancements are to your proposal throughout the project narrative. In addition to the narrative, we're going to require additional attachments. You see we require bibliography and references, also any commitment and pledge letters. We are not asking for curriculums or links to website or screenshots of websites. Unless those are included within the narrative, they will not be considered as appendices, and they could lead to disqualification if you include those. And just as a reminder too, we direct reviewers to only consider the information that is in the application. So if your narrative says, go to this particular page to see additional information, we direct reviewers to not do that, to only consider for review the information in the proposal. In addition, for each senior and key person listed in the proposal, you'll need to include a biographical sketch, current and pending, and a conflict of interest for each of those individuals. It's typically an area where folks only include it for the project director and then miss the co-project directors or other key personnel. Please don't do that so that it doesn't impact your proposal review. Additional forms and attachments that are required. Clearly, you need a budget and a budget justification. Any subawards for any partners that are also receiving funding to complete a portion of the work. And then within the supplemental information form, we're asking you to enter the code LX and then the name Rural Health and Safety Education, exactly as it is listed there, because that helps it move through our electronic systems to get to us. We've talked about the COI form. All right, all applications have to go through the federal grants portal, grants.gov. Please submit in advance of the deadline and get a case ID from grants.gov if you encounter submission problems. Some of those problems could include if you forget to convert a Word document to a PDF, it will get blocked. Or if you include a PDF and you've password protected it at some point and not released that, in that particular instance, those documents would be excluded for review and clearly are going to imperil the quality of the review that you may receive. Check the grants.gov manifest for any errors and make efforts to correct those and resubmit up until the deadline. As we note there, we will accept the latest valid application received before the deadline, but we also ask that you don't flood us with all of your drafts leading up to your final submission as practice. Get everything together, get it together correctly, and then submit in advance of the deadline. At that point, then you'll get an initial response from grants.gov confirming receipt of the proposal, and then a validation or rejection. That does not mean then that it will necessarily be reviewed by NIFA. It just means that it has met their basic threshold, and then it comes forward to us, at which time we'll do an initial confirmation of receipt and then a technical review to make sure that you've met all the submission requirements. If you have not, then the likelihood that you'll get a decline at that point, or if it has moved forward to the competitive peer review process, that it's been accepted. So let's pause there and see if there's any other questions that have populated the chat box.
I do have a few questions. Are previous or current RHSE recipient status considered to be in the application review? For example, if your organization was a successful applicant for the past 2019 or 2018 grants, are you out of the running for this cycle?
No, you're not excluded, but clearly it needs to be a different scope of work and or potentially build on existing work. And if you are going to have the potential for overlapping awards, then you've got to ensure then that the project director's portion of time that's allocated to the project is clearly demonstrated, and that your cost centers are set up to ensure that you're not going to run any issues with audits based upon any concern about potentially double dipping with taxpayer funds or some other concern. Uh, Also, we're going to want to have some indication that you have moved forward successfully with your existing scope of work on a current award. You'll have some additional um, pieces to consider if in fact you choose to submit for this particular cycle. And I also will note that this application process, the RFA, includes the announcement for fiscal year 21. Again, based upon if Congress provides an appropriations for this program, then potentially to look forwardly and be thinking about submitting to that cycle, which will have an earlier submission date. It's already listed in the RFA than this one has this year.
All right, next question. Is there a limit on the amount supporting staff salaries?
There's nothing specified in the RFA. So again, you're just going to have to, in your budget justification and narrative, be able to demonstrate then that those staff salaries are committed to the requirements of the focus of the scope of work. So if you're delivering education and training and you're paying the salary of those individuals to provide that education and training, then that's certainly going to match up with the scope. So where we see challenges, if we see in past peer reviews, if a lot of funding is going to administration and not really to the direct delivery to benefit the consumer. So just think clearly then how you're going to articulate that in their narrative so that reviewers understand, why the preponderance of salaries and or administrative costs associated.
Next question. The RFA states on page 15, the project narrative must not exceed 15 1.5 space pages of written text and up to 5 1.5 space additional pages for figures and tables. The
Mm-hmm.
font size for tables should be no smaller than 11 points Times New Roman. So is the total 20 pages then if you go heavy on the tables and figures?
It is, yeah. So you have that for potentially for a logic model, for other attachments that will help inform and influence the successful review of your application.
Next question. Would educational resources and training via virtual platforms be viable for grant consideration?
Absolutely. We are in the current environment, and we recognize that if and when there's a vaccine, that there are going to be challenges. So I certainly would encourage folks to be looking at those opportunities because if you do propose full in-person training and then reviewers aren't convinced that, based upon a locale or area, if it ends up being a pandemic hotspot, that you're going to be able to move forward with that scope of work, you should certainly have alternatives ready uh, to move forward with.
Next question. If we are not permitted to hire staff, is a stipend expenditure permissible?
So you are allowed to hire staff. So I'm not sure that maybe they'll want to reframe that question. You are allowed to hire staff. I just answered that a moment ago, I think.
All right, next question. There's a difference between page 6 of the RFA and page 22. Wanted to clarify that the budget narrative is listed as one of the narrative items, but it does not count towards the page limit.
That's correct. So project narrative and budget narrative are two different things. The budget narrative does not count against the project narrative.
Next question. Given our engagement with rural communities, would tablets and hotspots be permissible purchases with grant funds regarding hiring staff? Our university is on a hiring freeze.
Likely, again, in keeping with the scope of work, and that they're, so I think you're going to have to make the case then, uh, are those, again, going to be used by the existing staff and or volunteers that are assisting the program? Are they going to remain property of the institution going forward? And then if so, it should be allowable. And again, specific questions like that, you may want to just get additional clarification as you're putting the proposal together from Ms. Jensen or others in our awards management division.
There are no other questions at this time.
Okay, let's move it along and talk now about the review process. So I've alluded to this in a couple of different instances. We will do, after grants.gov pushes the applications over to us, we'll do a screening for these elements. You see that second bullet there, that's the harsh one. Late submission will be rejected without review. I've been with the agency now for coming up on 13 years, and I think every grant program that I've managed, every cycle has had at least one late submission, and some that have had multiple, because folks are well intentioned, they're working hard up to the last minute, they're waiting on that last letter of support, want to make sure that they've done everything properly, and then they may submit late or run into some glitch. We routinely reject those applications for review for the fairness to those that got theirs in on time. So, folks will call me and say we put in a lot of work, and I'm sympathetic to all that hard work, but I don't usually have an opportunity to say otherwise, that we're going to accept it. The extenuating circumstance would be an act of God, and we have allowed some related to as the pandemic initially started to unfold and folks from their universities had to move quickly to a remote working environment. We've now had, we'll have had several months to have worked through that, so that's unlikely to be an allowable extenuating circumstance. Keep me updated of any change in email address between the submission and the actual review process, should it change. All right, so we've talked about these as well. They're just restated here because they are fatal flaws, and for whatever reason, folks do um, uh, make them. So stay under the allowable amount. You don't have to request the 350,000. If you can do a scope of work over 24 months for 100,000, and you feel like that's your best approach, you can certainly do that. But if you go over, you're not going to get looked at. Similarly, if you exceed the 15 pages plus the 5 allowable in the table, then you'll be disqualified. All right, the competitive review process, once it comes in, then we're going to look at it for experts that we can identify who will serve to review these. Those include folks from other federal government agencies, those from other land grant institutions that may not be applying, veterans, farmers, producers, you name it. We will reach out to try and have a large swath of America represented in helping to review these proposals. You must follow the evaluation factors criteria in order to have a good chance at getting awarded, and only the information, as I mentioned, is used. All right, here's the role of the panelist. We will ask them to protect the confidentiality of themselves and of the materials that they review. We ensure then that no one has a conflict, and that's why those COIs that you as project directors will be sending in are so important, so that when we start to assign proposals, we're sure then that people that we ask to review your proposal have not worked with you in some capacity in the recent or near distant past. We obviously then at the end are also going to protect the information. We will share the results of the reviews with the project directors only. And so we will not send any information to sub-awardees. That's totally up to the project directors to do if they choose. Here are the evaluation criteria, and they are all equally important. Folks oftentimes can write a really good narrative, but don't necessarily back it up with their budget and their budget narrative, or those two things do not align. They don't demonstrate necessarily that they've got good management in place in order to be able to demonstrate that they're going to be able to bring that project to successful conclusion. So all these elements are critical, and we encourage you to invest enough time to give them all their due. You may have looked at this and heard this webinar and now said, maybe I'm not ready to submit, but I'd like to learn more about the process. And this is true for any of our grant programs. If you have associated expertise and interested, you can let Sydney and I know. In this particular instance, we'll ask you to send us an email with reviewer in the subject line, and then those other components included. Doesn't mean that you'll be accepted as a reviewer. It means that you will be included in the panel and the panel prospects, and then may or may not get reached out to for that particular cycle. It's a great way, though, to learn the process. Okay, any other questions that have come in, Sydney?
There are no questions at this time. Actually, oh, there they go.
Okay.
All right. First question. In our rural areas, most people don't have internet. Could we partner with a local library, for example, and pay for internet at the library so folks can go there and receive the education and training with social distancing regulation?
That would certainly be acceptable, and thank you for that particular question, because I didn't want to give short shrift to these issues related to broadband in rural, also the associated challenges that maybe folks may confront if they don't have access or high speed or Wi-Fi. There's a number of associated challenges. And so in that particular question or suggestion, that is a good demonstration about a workaround. And so that's one thing that is important in this particular instance too, if you're considering those kind of educational programming using those sources, and you are in a particularly rural frontier tribal community, that you help reviewers understand how the individuals and families are going to be able to access that information through those means.
Next question. How many applications will each reviewer evaluate?
That's unknown at this point. We depends on the number that we receive. So it's really a difficult question for me to answer.
Next question. Is the data management plan part of the narrative and count towards the 15 pages or a separate document?
It's required. It's included.
When is the deadline for the next cycle? And similar to the library question, could you partner with a university to disseminate e-learning curriculums?
So I don't see any particular issue with the e-learning curriculum. Uh, so yeah, I may not be understanding the question fully. So if folks want to clarify again in the chat, but that certainly should be allowable. And as you know, because it demonstrates then how the individuals are going to benefit from the other information that's received. But when just disseminating curriculum in and of itself doesn't necessarily mean that there's going to be uptake from the end user. And so then I think reviewers would want to ask in that instance, how can you ensure that that the curriculum is going to be utilized? So what's the actual training so that folks understand it and can benefit? Maybe that's what it offers. So any additional clarification the questioner might want is fine. Well, what was the first part of that, Sydney?
The first part of that was
Oh,
when is the deadline for the next cycle? And
can you look that up for me when I go through this next section?
sure.
Great, thanks.
There are no other questions at this time.
Okay. All right, we will move into the final few slides. This will be no surprise. Most of you on this call have written successful grants to us in the past. So those that are trying to break through, these are, again, elements that are not going to be unfamiliar to you. but it is important to really help reviewers. And think about that context. If you were, as you put a proposal together, if somebody was independently reviewing, is it clear? Is it concise? Does it speak to the requirements of the RFA? Does it match up with the evaluation criteria? Do you have an evaluation plan that will help ensure that this investment of taxpayer dollars is going to bring a bang for the buck, meeting some of those overarching programmatic goals of the Rural Health Safety Education Program? We talked about this earlier, your prior experience and success in working with the populations you intend to serve is critical. If it's a new population for you, then demonstrating how that experience will transition to support the new group. Your partnerships need to be articulated, and we talked about the management plan, a couple different slides so that we're clear who's got overarching responsibility for performing the work, that there's the right size staff and or volunteer contingent to be able to deliver, and then that you're going to have some kind of evaluation included so that we can ensure that we're getting a good assessment of the project so that we can say, yes, this is a good one to potentially scale up. We talked about fatal errors, so I won't spend more time there. And I just kind of referenced a good strategy is if you've got somebody on campus that is also not submitting, but is a trusted confidant who can review your proposal before you submit it to us and ask them to just be as harsh as they can be, because if they find something, our reviewers are going to find it. So anything that you can get weeded out before it comes to us is going to increase the chances of success with our program. Here are some of the common proposal criticisms. You may see these then and or recognize that maybe there's challenges as you're putting the proposal together. So what then can you do before you submit it to strengthen a particular area? All right, there's additional email address there. That's our policy shop. And we invite stakeholder input on this and the fiscal year 21 RHSC RFA. I will note that we have, obviously we've posted this as a 2-year RFA. It could be amended based upon direction that Congress provides for fiscal year 21 and or the appropriation of funds. So just note that, and you are welcome and encouraged to provide input in terms of what you would like to see the direction of this and or future RFAs take. All right, Sydney, I'll allow time for some final questions here. We are at 1:50, so we've got about 10 minutes if we need that full amount of time.
All right, there are no other questions in the chat box at this time. I do want to answer the question about the RFA deadlines. For fiscal year 2020, we are currently accepting applications up until 5 p.m. Eastern Time, July 1st. Fiscal year 21 will close out April 29th, 2021.
So obviously earlier in the year than about a couple months earlier in the next cycle. So again, if you don't feel that you're ready this cycle, you've got plenty of lead time, again, based on the caveats that I just offered up for the fiscal year 21 announcement submission.
All right, there is a question regarding the data management plan. Just looked at NIFA's data management plan FAQs link from the RFA, and it states, does the data management plan count towards the project narrative page? No, it does not count against the project narrative page limitation. I just wanted to be sure it didn't, because page 16 says it's listed in a subcategory of the project narrative of the RFA. And page 14 also states the RFA overrides the application guide if there is a discrepancy between the two documents. Just wanted to be sure.
Yeah, so in this particular instance, the RFA does take precedence, but based upon that discrepancy, we will note that in terms of any incoming proposal submissions and not disqualify based upon receiving the data management plan outside of the narrative.
There are no other questions at this time.
Okay, so I'll just stay on for a couple more minutes, but otherwise, wish everyone continued good self-care, practice social distancing as you put these proposals together, and then can, I think if anything, the current situation has helped to elevate some of the challenges that we're going to be facing, and we're looking for some of those innovative responses to be able to demonstrate that the federal funding is being responsive to the challenges that we're currently facing and are likely to continue to face going forward. So thank you for your interest in rural health safety education, your willingness to look for solutions to support some of the challenges that we face, and we look forward to receiving your proposals. Thank you.
All right. Brent, there is one additional question.
Okay.
Will grants support the cost of developing educational materials, cost of online tools to deliver the training to communities?
Again, I think you'll need to make the compelling case within the narrative why those tools need to be developed or that curriculum. And if you're building on the experience of faculty to then take something to a population, maybe it's a new population that's being targeted. I certainly think you can make that case within the narrative. If you are looking for funding, then to just develop the curriculum in and of itself, and there's no proven practice that it has been effective, then that's going to probably not score as well with reviewers because they may not have the confidence that that we've been able to successfully demonstrate that it's going to be able to get towards the required outcomes. So just think that through as you put the proposal together.
All right. There's another question. Is the grant interested in supporting minority groups like veterans?
So again, veteran population, I think certainly would qualify for receipt of services. We know that there are challenges associated with getting veterans in rural areas connected to their VA medical centers. We also know that there's large challenges related to homeless veterans uh, accessing and benefiting from healthcare. So certainly they would be qualified to receive services under RHSE.
Okay. There's another question. Is the disability population considered minority?
So certainly a vulnerable population, and I think you can make the case, based upon either census data or other state or county level data, why you're potentially targeting the disability population, within the minority context. So again, use your most recent data and as granular as you can based upon the target area if you're going to serve that particular population. It's not specifically listed in the legislation, but I think you can make a case, again, based upon the available data.
All right. There are no other questions.
Okay.
Oh, there's one more that came in.
All right, good.
How many applications have you received during 2019 and approximately how many have been funded?
So I don't know the number that were received, and you can probably help me out with the number that were funded. Sydney, was it somewhere between 6 and 8?
It was between 6 and 8. If you go to read the abstracts and click on that link that is in the in the chat, you will see 1, 2, 3, 4, 5, 6, 7, 8. There were 9.
Okay, total of 9 funded in the previous cycle. We're anticipating, a little north of that figure because of the additional $1 million that Congress appropriated for the program this year related to the telehealth and distance education.
I'm not seeing any more questions at this time.
Okay. Well, I want to thank all of you that joined us once again and wish you well. We look forward to receiving your proposals. We'll conclude the webinar at this time.